A patient came in with the worst headache of his life. As a neurologist, that is one of the most terrifying things I could ever hear. What I'm worried about is a brain bleed. He says that this is a 10 out of 10 headache. I am worried that he has blood in the brain that is building up. If we don't find the source of this bleed, it could keep expanding. He could become confused. He could fall asleep and lose consciousness and not be able to wake back up. He could die within hours. So I need to know more information. He does say that he's had migraines in the past, but this is nothing like the migraines that he's had before. He used to be able to take over-the-counter medications like Tylenol for his headaches. Nothing has helped this headache at all. It's all over his head. And worst of all, his neck hurts. He has a stiff neck and he's not able to move it as much. That makes me think that there might also be blood going into the area surrounding the brain, also affecting where our neck is. And so we need to find out more information. He has some nausea, no vomiting, and he's having some blurry vision. On exam, he doesn't have a fever. He does have an elevated heart rate. He is breathing on his own. When I look at him in general, he does not look well. He looks ill, he looks uncomfortable, and he's not moving his neck. When I move on to the neurologic exam and look at mental status, he's awake. I wouldn't call him alert. He's lethargic. It takes moments and multiple stimulations for him to answer my questions and follow commands. So when I test his cranial nerves, his vision's intact. His pupils are equal and reactive to light. But when I test his extraocular movements or how his eyes moves, he's able to go up, he's able to go down, but he can't go all the way to one side or all the way to the other side. So he can't abduct completely, which also makes me worried that there's increased pressure in the brain. And one thing that can cause that is a brain bleed. Interestingly, for brain bleeds, there are different causes for them. It could be that there's a ruptured aneurysm, or there could have been trauma. When we keep going on with the exam, his face is sensations intact. He's able to activate his smile. He can raise his eyebrows all the way. His hearing is equal on both sides to finger rub. His palate is elevated, and then his tongue is midline. When we go on to the motor exam, I don't notice any abnormal movements. His tone is intact. And when I ask him to push against me for confrontation exam for me to test his strength, both of his arms are very strong. But when I go to his legs, I ask him to push against me, both of his legs, he can't push all the way. He does not have full strength for his legs, telling me that he has weakness in his legs, which also makes me think that something is going on in the brain. And interestingly, now I can start thinking where exactly in the brain this could be happening. For legs, that would be, and for strength, we would think about the motor cortex. And for legs in particular, I would think about the medial portion of the motor cortex. And then if I'm also thinking about a brain bleed, it could be an aneurysm. One of the most common places for an aneurysm to rupture and cause a brain bleed is the anterior communicating artery, which supplies this medial part of the motor cortex to cause weakness in the legs. So now I'm even more worried. We keep going on with the exam, sensations intact, his reflexes are intact. Because he is so sick, I do not test his gait. He does have intact finger, nose, finger, and his heel shin is intact as well. So now that I have my exam, he's told me his history. I'm thinking about what are things I cannot miss. He came into the hospital because he had the worst headache of his life. So one thing I absolutely cannot miss is blood in the brain. But as a doctor, I cannot anchor. When we say anchor, that's like you're in a ship, you throw the anchor over and you stay still. You just stay there and you don't think about other options. But we have to think about other options for our patients. So even though I'm worried about blood in the brain, this could also be meningitis. He could have an infection. He doesn't have a fever, but he could have some type of infection that's causing the stiff neck. So it could be that's what's causing the stiff neck, not necessarily blood in that area. We could also think about trauma. He didn't tell me he had any recent history of trauma, but it could be trauma. We could think about a metabolic cause. Could there be some type of sodium change or potassium change that could be contributing to this? Could it be autoimmune? Is there some type of inflammation in his body that's leading to this very severe headache? And neoplasm. Could this be cancer that's leading to the worst headache of his life? And as a neurologist, I'm always going to consider seizures. I don't think this is a seizure. It's going to be my differential diagnosis. So we've done our exam. We've thought about what this could be. For me to rule out the biggest and scariest thing, I'm going to send him to a CAT scan right away. He is getting a stat CT scan. And we send him to the CAT scan. What I'm looking for is there any new blood in this brain? On a CAT scan, that will be bright and white. And when we send him there, we see blood in the brain, a bright white signal on this CAT scan. And where we see it is indeed in this frontal region. We have to know where's the source of this bleed. So to look at vessels, we have to get a CTA or a CT angiogram that can look at the vessels in the brain. And when we do that, we saw that it was indeed at that anterior communicating artery. That is where the rupture of an aneurysm was. He went to neurosurgery. They performed brain surgery for him. And at the end of the day, when he finished his hospital stay, he was able to walk out of the hospital. He did not die. He did have a little bit still weakness in his legs, not too profound, and he had a little bit of memory concerns. He wasn't able to think as quickly as he used to, but overall, he's alive today.